Hello, Mr. Williams. This video will provide you with some information regarding your mother's condition, type 2 diabetes mellitus, but we will call it type 2 diabetes for short. There are two main types of diabetes, type 1 and type 2, which are similar in their effects but are physiologically different. Both types revolve around the hormone insulin. Insulin is produced in the pancreas and transports glucose, or sugar, from the bloodstream to cells for them to use as energy. Diabetes is a result of either insulin deficiency or insulin resistance. You will notice that medication to treat the condition is included in your mother's prescriptions under regular insulin, which will be administered on a sliding scale based on her glucose intake and as NPH insulin.
When a person has type 1 diabetes, their pancreas is not able to produce insulin for many different reasons, ranging from genetics to viral infections. As a result, glucose from the patient's diet will remain in the bloodstream and will not be transported to the cells for energy. This is why diabetic patients are prescribed insulin shots or insulin pumps in order to supplement their body's insulin production deficiency.
On the other hand, type 2 diabetes is a result of insulin resistance. This means the body does not allow insulin to perform its job properly or efficiently and is the more prevalent of the two types. The exact cause of type 2 diabetes is still unclear, but genetics, diet, and exercise have all been linked to the condition. The presence of insulin resistance causes the body's cells to not respond well to insulin, and the cells do not receive glucose, which is their vital source of energy. As a result, the doctor may prescribe insulin to aid in glucose transport, as enough insulin will help the sugar enter your cells, but other medications may be needed as well. Patients with type 2 diabetes are urged to strictly moderate their sugar intake and adopt a more active lifestyle.
As we have discussed before, Mr. Williams, one of the major causes of type 2 diabetes is genetics, and as a result, you may be at high risk of developing type 2 diabetes. However, this does not mean you will certainly develop this condition, as there are ways to prevent or at least delay the onset of diabetes. We urge you to start managing your diet as soon as possible, because an unhealthy diet puts stress on the body that can activate the insulin resistance gene. Also, should you develop diabetes, it will be easier for you to manage your blood sugar as your diet is already healthy. Additionally, we suggest that you adopt and maintain an active lifestyle. This will help your cells use their energy efficiently and not rely on glucose as their only source of energy.
We'd like to remind you that you have a follow-up appointment on November 1st at 10 a.m. with Dr. Glenn Dueller in the endocrinology department. Your appointment will be held at the Coumadin Clinic at 5500 Campanelli Drive, San Diego, California, 92182. If you have any questions or would like to reschedule your appointment, please call the following number at 619-594-1234. In the meantime, if your mother presents with any complications of diabetes, including altered level of consciousness, excessive thirst, hunger, or urination, please contact Dr. Dueller or emergency services immediately.